Mosquito season is almost here, and with it comes something most pet owners don't think about until it's too late, and that's heartworm disease. It only takes one mosquito bite, not 10, not a swarm, just one. And what happens after that bite can affect your dog or cat's heart, lungs, and life. Hi everyone, I'm Anne, a veterinary technician, and today we're going to talk about heartworms in dogs and cats. What they are, how they spread, why mosquito season matters so much, and why monthly prevention and annual testing are absolutely non-negotiable. And I'm going to be very honest with you today because this is one of those diseases that is devastating and almost always preventable. Stick around to the end, I'll clear up some myths. So let's start with the basics. What is heartworm disease? Heartworm disease is caused by a parasite called Dirofilaria immitis. It's a long, thin worm that lives in the heart and pulmonary arteries, the large blood vessels that connect the heart to the lungs. It is spread through mosquitoes. Here's how it works. A mosquito bites an infected animal and picks up microscopic baby worms called microfilaria. Then that mosquito bites your dog or cat and deposits those larvae in their bloodstream. Over the next several months, that larva matures, they migrate, they grow, eventually becoming adult worms that can reach up to 12 inches long, inside the heart, inside the lungs. So the next question is, why does the mosquito season make this so important right now? When people think about heartworms, they often think that's a summer thing. But here's the truth. In many parts of the country, mosquitoes are active from early spring through late fall, and in some regions, they're active year-round. It only takes temperatures consistently above about 57 degrees for heartworm larvae to develop inside a mosquito, which means once we start warming up, transmission risks begin. And here's something else that surprises people. You do not have to live near a lake. You do not have to live in the woods. You do not have to see standing water. All it takes is one mosquito in your yard, or one that gets inside your house. Indoor pets get heartworms. Apartment pets get heartworms. City pets get heartworms. This is not a rural-only disease, and that brings us to dogs. Dogs are what we call the definitive host for heartworms. That means the worms mature fully in them, they reproduce in them, and the infection progresses. Early on, heartworm disease can be incredibly subtle. A mild cough, a little less energy, maybe they don't want to run as long as they used to, and many owners don't notice because it's gradual. But as the number of worms increases, the damage increases. We start seeing exercise intolerance, persistent coughing, weight loss, labored breathing, fluid buildup in the abdomen, heart enlargement, and heart failure. Now here's the part I really want you to hear. Treatment exists, but it's not easy. It is not gentle, and it is not cheap. I want to explain this carefully because a lot of people think, well, if my dog ever gets heartworms, we just treat it. But heartworm treatment in dogs involves a series of injections, strict crate rest, often for 2 or 3 months. Why? Because when adult worms die, they break apart and travel to the lungs. If a dog exercised during this time, those fragments can cause pulmonary embolisms, which can be fatal. So dogs must stay calm, no running, no playing, no excitement. Imagine telling a young, active Labrador they cannot move for months. Now, we need to talk about cats, because cats are different. Cats are not the natural host, and that sounds like a good news, but it isn't. If you have a cat and you've ever thought, they don't go outside, so they're safe, they're not. Indoor cats are at risk. Mosquitoes get inside homes all the time. In dogs, dozens of worms may be present. In cats, sometimes just one or two worms can cause severe disease. When worms reach a cat's lungs, they can trigger intense inflammation. This condition is called heartworm-associated respiratory disease. Cats may show coughing, vomiting, difficulty breathing, lethargy, sudden collapse, and sometimes sudden death. And here is the hardest truth. There is no approved treatment to kill adult heartworms in cats. We can only manage symptoms, which means prevention is the only real protection. Now let's talk about what actually prevents this disease. Heartworm preventatives do not kill adult worms. They kill immature larvae before they mature, which means timing matters, consistency matters, and missing doses matter. Most heartworm preventatives are given once a month. Dogs often receive a chewable tablet. Cats typically receive a topical medication applied to the skin. Some combination products also protect against intestinal parasites, fleas, ticks, and even ear mites. I've linked veterinary recommended preventatives below in the description. A prescription from your veterinarian is needed to purchase heartworm prevention. But please understand, the most important thing is consistency. Missing even 1 or 2 months can allow larvae to mature beyond the stage prevention can kill. And once they're adults, prevention can't fix that, which is why annual testing matters, even if you're given prevention. I hear this a lot. My dog is on prevention, so we don't need to test. But we do, and here's why. No medication is 100% failure-proof. Dogs sometimes spit out chews, life gets busy, doses get forgotten, or given late. Heartworm tests in dogs detect proteins from adult female worms. We test annually to catch infection early, before severe damage occurs. It's a simple blood test, quick, routine, preventative medicine in action. In cats, testing may be more complicated. It may involve antibody tests, antigen tests, x-rays, and sometimes ultrasound, because heartworm disease presents differently in cats. Testing is about safety. It ensures prevention is working, and it ensures we are not missing something silent. Which brings us to a mindset shift, because heartworm disease is not random. As a veterinary technician, I want to say this gently but clearly. Heartworm disease is almost always a lapse in prevention. Not because owners don't love their pets, but because life gets busy and mosquitoes are easy to underestimate. But this is one of the few diseases in veterinary medicine where we truly have control. Monthly prevention, annual testing, year-round consistency, that is it, and that is powerful. Before we close, let's clear up a few myths. Myth number 1, my pet stays indoors. Indoor pets get heartworms. Myth number 2, I only need prevention in summer. Mosquitoes don't follow calendar dates. Myth number 3, I'll just treat it if it happens. Treatment is harder, riskier, and more expensive than prevention. Myth number 4, cats don't get heartworms. They absolutely do, and they have fewer treatment options. Now here's what I want you to do. Check your pet's prevention schedule. Are they truly year-round? Set a monthly reminder in your phone. Keep doses near something you use, like your coffee maker or calendar. If you need supplies, I've linked veterinarian recommended preventatives below. You will need a prescription from your veterinarian to purchase heartworm prevention. Schedule annual heartworm testing. Prevention is not dramatic, it's not flashy, it's quiet, consistent, and responsible, and it saves lives. If you take one thing away from today's video, let it be this. It only takes one mosquito bite, but it also only takes one monthly dose to prevent a devastating disease. Heartworms affect dogs, they affect cats, they affect indoor pets, and they are preventable. If you found this helpful, consider subscribing to see more videos like this one, and share it with another pet owner who needs to hear this. And remember, this channel, Vet Tech Pet Care, is about prevention, education, and giving your pets the healthiest life possible. And I'll see you on the next video.